Sciatica in pregnancy is common, but it's not something that you should have to suffer through. Hey moms-to-be, if you're pregnant and dealing with that deep, shooting pain down your back, your butt, or your leg, it's most likely sciatica, but you're not alone. Sciatica in pregnancy is super common, but it doesn't have to be something that you just deal with. My name is Dr. Gerianne Lewis. I'm a PT, and I help expecting moms stay active and feeling good through pregnancy and prepare for a smoother labor and delivery. Today, I'm breaking down what causes sciatica in pregnancy, simple ways to relieve it, and how to prevent it from taking over your pregnancy experience. Let's get into it. So what exactly is the sciatic nerve? It's the largest nerve in the body, originating from the lower spine and running down through your butt and into your legs. When it gets irritated or compressed, thanks to postural changes, a growing belly, and shifts in weight, you may get that sharp, burning, or even numb feeling down your leg. Does this sound familiar? Pregnancy changes everything about the way we move. As baby grows, our center of gravity shifts forward, putting more pressure on the lower back and the pelvis. But that's not all. Hormonal changes cause ligament laxity, meaning there's more movement in joints than usual. The lower back tends to arch more, tightness can develop in the pelvic floor and hip muscles, and swelling or fluid retention can also contribute to nerve compression. Plus, as the uterus grows, it pushes on surrounding structures, which can further irritate the sciatic nerve. Here's the thing, nerves don't like to be stretched or compressed. That's why stretching usually isn't the answer. The sciatic nerve needs to move smoothly through the muscles and joints, and when it can't slide and glide properly, irritation happens. The key is to keep it moving within comfortable ranges rather than forcing deep stretches. All right, let's talk about relief. So if you're feeling that sciatic nerve pain, nerve glides can help the nerve move better without excessive stretching. So here's how to do it. So for a seated nerve glide, you're gonna be sitting on a chair with one foot flat on the ground and extend out the other leg. You're gonna point your toes as you look down towards the ground and then flex your toes towards you as you gently move your head up. This helps the nerve move smoothly through its pathway without overstretching it. Try repeating it for 10 reps on each side and be sure to keep this in a comfortable range. Because there are different causes of sciatic pain in pregnancy, each person's plan may look different, but the nerve glides are a great place to start. Now let's talk about how we can prevent sciatica from creeping in the first place. It's all about posture, movement, and strengthening, so here are some of my tips. Number one is to keep moving. So even if you're feeling a little discomfort, movement is medicine. Gentle walking, stretching, and prenatal-friendly exercises can help keep your spine and hips happy. With that being said, listen to your body, and if symptoms are getting worse with certain movements, hold off and seek care from someone specializing in treating expecting moms. Tip number two is minding your posture. So things like trying not to slump when you're sitting or paying attention to your posture when you're standing, making sure you're not leaning into your low back too much. Tip number three is strengthening your core and glutes. So your deep core and glutes are your best friends during pregnancy. A strong core supports your spine, and strong glutes are going to help support your pelvis. Sciatic pain doesn't have to take over your pregnancy, and with the right movements, posture tweaks, and strength work, you can keep it in check and stay as comfortable as possible. If you're looking for more guidance, download my free guide on back pain in pregnancy. It goes over common types of pain in pregnancy, including sciatica, and photos and instructions for the recommended movements. See you next time, moms.